viewers, and welcome again with me, Kona Sise. Today we can work on healthcare for the aged for witness as Sierra Network Charity Foundation. They give a donation to healthcare for the aged.
Greetings to everybody now. Me Abraham Akemta. Most people know me for AAA, the CEO and the founder for Sierra Network. We get to Charity Foundation. We are the lead director now with Mr. Bauna. We meet up now AYV. That day we will be do the NAP hit presentation, and we be able for listen to what you be said that 10 day, and we be like what you do through the lead director when Dr. Isatu maybe get a channel we connect to now too, and promise me make, and that's why I'm here. Sierra Network Charity Foundation, foundation we're based in New York and United States, but we get members all across the diaspora. We and people then get a radio station. We till we talk live by example. We don't already go na the grafting people for the aged. We don't donate to 110 about 10, and we believe say the old people then self need for be recognized, and how you be on the advocate for them. We believe say the little thing we can do to help for push. We self not get because now how people in the contribute monthly and the key, and so we self the pick and see like who side the need day for, and they will be able for can do them kind of donations there. Yeah. So that's why we're here today.
Thank you very much. We pray that God will help you all we want to succeed, because the ultimate aim of the Lord help humanity. Healthcare for the aged. Now an organization we take care of older people and we're going to have to reach communities. Communities that we know accessible, communities that we know motor. During the 2015 housing and population census, we get about 7,133 people in this country, where we get 264,826. We are older people. And among that, we get about 80% of the noble school, only 17% go school, 3% go university. So the 80% we no go school no get forget benefits. So we they cater for them people, and now them people and they go to the slum area, and them people and they go up the hills them. So we they go there with a medical assistance. Normally we go, we give them treatment. If they're not fit, we can take them with little over to go there at Connaught Hospital, we foot the bill, then we can turn them back to the community. We also they act as an advocacy. We try let people and get this understanding. Say the older people in life it also matter, because then our old people and we don't serve this country. Now some of them old people in they build PCO, and they build law court, they don't old today, but because of them not go school, they know they in a system. And if you find out now, the highest they can give you for pension for people away not be they go school, them do gas not smoke now 250,000 a month. So that is also small. So we they advocate because the people they not get nothing, and make we go meet them. We they act like a mobile clinic. We they go na hard to each community. As I talk so now, we they on a program for go na Falaba. We they on a program for go na Kwenadibu district. All this na two we will they na yasu. We will na see. We not get no external. And the first time this we don't see people away come to real aid. No one day get away possible can meet we say with the kaya today no na local council to na they do so and so no help una na una na the first we tell una thank you so that we are not able to stop here na be able to extend and other attend them and to other people them back where they care for the older people them. We tell una thank you very much, and I believe say una mutu na this not words. You know, since me and that woman they talk, you know, he not talk to me but na the action is una welcome na Ayana on office anytime una want for kaya. Healthcare for the aged, the older people, their life matter, once a man, twice a child.
So, going around, putting at the worst scenarios where old people in the face in this country?
Well, number one, loneliness.
Okay.
Number two, then they eject them. Like we get one mami who then call Mami Kumba, then they have an upline, they say the witch. So they get for Kana for it on. Because of being able to afford rent, it go up the age then. So he did it in one, we get another one also in Apatamba. Then also poverty, access to medical facility for the older people there. You know, we go to this community then called Book community as I talk to you, but let them access any medical center. They take them something like 5 miles. So we go there because of we on good work where we they do, then give you the 2 town lots. But now say we they shame for pass around it because they take us say we rely. Because then the wallow just erect for them something like a building so that outside them will get the treatment there. We don't see a scenario up the hills the way that the couch the Leone and done, you know where the Leone and the couch are done, they put inside blanket now say no let them go, we broke one make shit out, we put the Leone and the can on the boy before the foot sleep, the Leone get for down in the sky, the woman died, the king died. That's an upgrade in good community. We don't see scenarios then when Mami Awa, you know, you don't hold, you don't get side for sleep, they don't get a notice, you know, we get for raise fund to the WhatsApp forum, we give them 600,000 for rent, they give them 400,000 for you do business. Now as I talk to you, so now it is sell cow milk. The people they need government, they need people away for help them. People and they when are all people where they able to pass on their idea. And they can always say the older people are a living textbook. Although they encourage them. And most of the disease where they affect them, of course, stroke, high blood pressure, diabetes, and we all know say not to sick the normal way. They're sick in a terminal disease, and it's very expensive, and they're not able to access health facility, and they don't own. And you understand, say the mobility rate, na Sierra Leone, the movement among the older people, you know, is very, very low. They know they move. And disability, when people they all about disability, a day among the older people about 56%. All the blind people they want to see. They can't donkey see them better. If you go up the hills, they also they go. And they tell you how they go, Mutukano they go, they can they go, they bike they go. We get about 1,500 videos, we get 7,000 pictures as evidence. We be one for do them as a community base, but we come overwhelmed with people and now when they call we, you know, we tell them thank you, but the thing the way they want the older people because government don't get any comprehensive program when I heard about the older people in this country. I think now we don't start up.
So being that you're not able to foresee, you're not able to listen to the people, and you feel with the people, let's say somebody asks you now, say, how do we fix this? If you're able to get 3 solutions, what are those?
Number 1, I would like to get a geriatric home where we're able to cater for a lot of people, although not to all people, and get for the like 6 mile. Number 2, let me get like a mobile clinic for the older people. At least we go meet them at the community. Then also let me do public health sensitization so that people go understand, say, for help you come to mortal man, not to a privilege, not a right.
All right, thank you very much.
Thank you.
We're just able to make you talk small so that listeners that we're out there, viewers who know they watch right now, maybe will not be done able to watch the video at that time where Dr. Isatuka Kejalo video on AYV, but today we're not able to listen from Mr. Bar, we're not able to get exactly what he looked like. It's possible. Everything is possible with the mindset, but this is not salute. On behalf of Sierra Network Charity Foundation, we donate the sum of 4 million loans to HealthCare for the aged. We hope see this one we're able to do the little we're able to do for which the people that we are the beneficiaries.
Thank you very much, and this will touch people and one out of us, now one of the force organization when I don't come. We are more alone as talk them here. Everything because we get the skill, we get the manpower. In a medical professional, we want for help older people. And an old person is me and how we struggle. And we take it die. People don't even know say don't die. and if we are in school, always police and say, at the end, all that people will die like a youth. So that's what we really have to do. And thank you very much. They will continue for giving people really do that, so that they will see at least we are doing a very good job. And thank you very much. Let God will continue. And this will reach to the older people. This also for we believe, say, even if we don't get this one next one, the Almighty God will all serve, we will be able for giving and people to this organization. So we open up for money business, we not for long this because several people don't need to say, this idea, I don't write on a project, don't go to government organ and negotiate, this one for everything. Because if you say that you necessarily ask the goals, nobody will go because you know money, we want for help people. We are saying a mental foundation, I don't try on a people who want to win. Want advanced stage in particular because we plan next Sunday to go what's happening. Then we get about 400 people, they will go to it, so we invite you now. This money we use them for procure medicine, and of course, please, we invite you now for good after this Sunday, we can the next Sunday. Thank you very much, and God bless you.
Hello and welcome to this interview. Mina Kuna Sisi from Sierra Network. Do please introduce yourself.
Yeah, you're welcome.
What's your name and who that you be in this organization?
Yeah, Mina Mohamed Esba, CEO, founder HealthCare for the Aged, Sierra Leone.
Alright, you go tell me what in this healthcare they all about.
Healthcare for the aged, we go for go treat older people and hard to reach communities. Communities that we not accessible, communities that we not motorable. We go give them first aid treatment from them. If they're not better, we able to take them go to hospital. We give them medical attention.
So how long this organization don't exist for?
This organization don't exist since 2016, November 4. But we get them registered 2018. So still then it still exists.
Somebody could look for no what in move this organization for cater for aged people them.
Well, as we all know, the older people in this country, they be making housing and population census. We say we get about 3.5 of the older people way then in this country, and we get about 80% of the no go school. So then they suffer, and Sierra Leone we not get no comprehensive health program for older people. And so we decide, say, you know what, let me go. Then also, old mommy raise me up. The old man will be there up ill, the mommy suffer till he die. So we decide, say, because let we start for the treat the older people, and then back the life also matters. So we begin to go up the hills, they go to the slum area. We don't go all over this country now, they treat the older people. Then.
What's another good story where you go tell people about this organization when you get for do it helping the needy, the old people where they in need?
Well, we get a very, very good story. We get people that now as they talk so now like Patambai, the Waka Kando, we get Mami Kumba, they all they do now then subsistence farming in the area. At times we can go, we give them small thing, or give them and take and say, well now, Lord go buy, if not granite, then go buy and then can plant and at least then they able to contribute to society. And many people don't forget, say, who say older people who crime no they and they able to talk to them to them picking there. Where government they invest by youth, yes, it's very, very good. But talk to the Peking, Papa, let talk to the Peking so that the problem will solve.
All right, you talk of government investing in youths. When you talk about helping people, you get to think about finance. So how this organization they do for get revenue?
Well, this organization, they live with the people away we get around, that they believe the concept of what they do. And of course, would they live like some of una own just believe so they do a very good work. I make una kaya na so we they live. But we believe say owner don't start and so other people they must see and then go follow because we do the right thing, we get evidence about them, we get everything. We know to fake advocacy with paper. We get video evidence, we get everything for proof saying that the right thing they do.
So, how you feel today for receive a donation from Sierra Network Charity Foundation?
Well, I feel humble. I feel say at least I dey help humanity. I not go feel proud. No, I feel humble because they don't give it today. They give it a load because it's not a big load for go left hand to people because it's not money. If they give you money, give people them. I believe say the God who they serve go only. This is not a big load. 4 million, a big load. Because temptation they per money. So I pray that we will be able to go deliver and safe will give to the right people, and so the right people will get the benefits.
Alright, for as somebody wey don dey work for see that old people and wey dey in need get help, what are your expectations from people wey dey listen and watch right now?
Well, my expectation na let people even if you no able for come meet healthcare for the aged, you neighbor and for help if na old person. If you watch your neighbor wey don old, you no cook for 2 days, go watch to am. If you know well, help am go to an hospital, because some people and the situation wey they face, not to them create am for themselves. Life not easy for them. Life not easy for all, but try for help your neighbor. And if you always no say for help you, come be human being, not to a privilege and a right.
For somebody where they listen and watch right now, where they in need, but they don't know how for contact una, how una can do for reach to them people and they.
Well, we contact them when 076-255-094. Then we address them at number 5A Ross Road. Anything we possible want for donative, na kitu ligen water, you get anything. Then also you can able kana. Then also we get to website when www.hca.org.
So what will be your final message to Sierra Network Charity Foundation and also to old people out there where they listen and watch you, where they in need but don't know how to go about them?
My final message to the people where they help Sierra Network Charity Foundation will help them because then they help the right people them. And not be expect them say they will come. Maybe visitors from saying one bag guess they will count. But they count enough money we Waterloo trip now, we don't save. So by God in power, the 250 people who don't cater for our Waterloo, I believe say they will smile after we commodity.
Thank you very much.
Thank you, welcome.
Hello and welcome to this interview. Do please introduce yourself.
Mina Khadija Tojale, I'm the procurement officer of HealthCare for the aged.
Alright, so what your job entails?
My job now for buy medicine and go check on the older people waiting they need for what we do for them.
Waiting the older people they need. So far, ever since you don't start this job, tell me waiting old people they need.
The old people they need medical facility. The old people they need housing facilities. They get so many things the way the old people they need. They not get hospital for themselves. They not get geriatric home for themselves. So they get beaucoup things them with the government for help and other people them because not only government for help older people them. Me and yourself for help older people them. So they get so many things them where they need. So I believe in that.
The government need for help older people them. So as somebody where don't they go out there for know what people need and for help them forget what they need. What are your expectations from people who they listen and watch you right now?
I expect people and like where we come as a organization, family, as what we self they do. The other people them out there where they able for help the organization, where they help the older people, they themselves help with when they out there.
According to the CEO of this organization, he mentioned say revenue not they come out from government now. Una will make up the organization. So how challenging it don't be for Una so far, getting revenue for these people where they in need?
Actually, we get so many challenges, but everything, we just put we hope to Allah. Now the best thing that we hope for, because if I get me own Lily, my brother and the CEO get the lady we other, we can do.
Okay, trusting in God and also be today that Sierra Network Charity Foundation can do this donation, and be that you be the trust in God. So how you feel about it?
I really, really feel good and appreciate Sierra Network Foundation. And I tell the president, the founder, everybody else, and the one way they help Sierra Network Education, they continue for help Sierra Network Charity Foundation. They then continue for help them because they help the right people them also.
So finally, send what to viewers out there about helping people in need, especially old people.
I still don't understand.
All right, you send message to viewers out there where they listen and watch you now about helping people in need. You neighbor where you they close to, where say this now old person where they in need. What you go tell them?
I tell them say for help, not to privilege. Now the right thing for do. When you help, tomorrow you self go need help. So help na goodness. Now right thing for do. So I'm young. Thing that I tell people, una help the older people, una help people where they need, not to all the older people. Sometimes the older people and the young people also they need. If possible, this young guy needs something, If you push them, you help them, he achieve nothing, you don't get good name, and you don't help that person, they must get another person where they help. So look, try to be good person.
Thank you very much.
You're welcome.
Viewers, una sef don witness the donation wey Sierra Network Charity Foundation can give to the people wey dey na health care for the aged. Dem people here don talk of how happy dem be for receive this donation from Sierra Network Charity Foundation, and they don talk about how the organization come about and how much people wey dey in need, when are old people, they suffer because people no dey for give them attention. And so then they send message to viewers out there that if you know somebody, we also know somebody when an old person where they strain, be it old or young, make sure you render help to them because themselves they serve for person where they give help to other person where they in need. We bring the program come to you today. My name is Kona Sise. Until we meet again to another edition of Talk to the Camera. Have a wonderful day.